What could be an effort to keep nurses working in the country amid a pandemic? A private hospital celebrates Nurses Week by offering perks to existing staff and newly hired ones. We speak now with Dr. Dennis Serrano, St. Luke's Medical Center's Executive Vice President. Doc, thank you so much for joining us. What is the current ratio of outgoing nurses and incoming nurses into St. Luke's hospitals?
Currently, Rico, there are more outgoing nurses. Every day we have resignations. And the resignations are not just for going abroad. These are nurses who are going into other careers. So there's always a continuous exodus. Currently, our hospitals lack a little over 100 nurses in each. And we're trying to fill in that. You can imagine that is a big deficit, and we're trying to fill that in day by day, and we're trying to cope with that.
Is it because nurses are also leaving private hospitals because the pay is not good enough?
Well, we've tried to rationalize pay. There are a lot of reasons for nurses leaving private hospitals. Of course, pay is one of them. Opportunities abroad is another. Professional advancement also comes into the picture. And we're trying to look at all of these and trying to alleviate or trying to help solve all of these issues in order to entice our nurses to stay with us. We want to be the preferred employer for nurses. And like I said, so the celebration of the Nurses Week is just part of what we're trying to do to help and to ensure that the nurses are taken care of, to make them feel that they are valued, because truly they are valued, and to help them to entice them to stay with us. So this is something that we've done traditionally over the past several years, decades even, and this year is no different. We're giving them more perks. We're giving them a lot of new bonuses and a lot of freebies, in order to feel that they are valued employees of the hospital.
Absolutely. And where are you hiring your nurses? But on the other hand, are there also enough nursing graduates to be able to fill up this deficit?
Well, the short and long answer to that is apparent. Of course, no. Definitely the pandemic has taken a toll in nursing nursing graduates. Over and above that, there are still even fewer enrollees, I think, over the past couple of years, with and without the pandemic. So there is a dearth of nursing graduates, and we're trying to entice even graduates from provincial nursing schools to come and join us. We've given them free airfare. We're giving them free accommodation and lodging while they're employed with us, the provincial nurses. And this is part and parcel of the package to try to attract them to join St. Luke's. And I think this is something that many of the private hospitals should think about. Putting more weight on what nurses need, right, other than salaries, what they need, in order to live a comfortable life.
St. Luke's at the moment is one of the premier private hospitals in the country, Doctor. And of course, local nurses are using their experience at St. Luke's as a stepping stone as well to work overseas.
Yes. Well, it goes both ways. We're pretty proud that we're able to train nurses in such a way that they become valued employees and preferred employees abroad. Of course, that redounds to us losing a lot of these nurses. I can tell you for a fact that we've trained very good nurses in the past, and now they're all abroad. But that doesn't deter us from doing what we're doing. It just drives us to train them better, train more of them, so that there will be enough to give valued healthcare and professional healthcare to both our local patients and to whoever. We're not going to stand in the way of nurses trying to advance themselves professionally. That is not something that that we do. But we do everything in our power to prepare them, for later challenges in the future.
Absolutely, of course, that's really very important to know the progress of their careers. I want to ask you, Doc, about Omicron cases at your hospitals. Are you seeing a rise now in infections?
Well, fortunately, we haven't. There are a few cases, single-digit cases in both St. Luke's Global City and Quezon City. We're always vigilant, and we're always prepared for any upsurge. But fortunately, we haven't seen any. And the cases that we've seen are pretty mild. A couple of them are just asymptomatic. But nonetheless, we're prepared for any upsurge in these cases.
Dr. Dennis Serrano, thank you so much for joining us. St. Luke's Medical Center's Executive Vice President.